Kim came in with some of the typical symptoms of reflux, a lot of burning sensation, particularly when she lays down to go to sleep. She has acid come up into her throat. And so we did an endoscopy to look at her anatomy, and she did have a hiatal hernia.
Before I found Dr. Ihde, I had been on GERD medications for over 10 years. I had been diagnosed with a hiatal hernia, which conventional wisdom had told previous doctors that we'd just leave it alone. It wasn't bothering me that much, and I would learn to live with the GERD, that you medicate it.
Most of the patients that self-refer themselves are so far along in the disease process that they have not just the reflux, but they have other damage as well.
So he checked everything, not just what would have been GERD related. He wanted, it was like the whole picture of Kim, rather than just, oh, just this one little thing and this one little medication and she's tired of taking it. It wasn't that approach at all.
We went through a little bit of the history of surgical treatment of reflux disease to give her an idea of how many different things have been tried and what the outcomes are. And then we talked a little bit about the newer procedure, how that we could use this in concert with her hiatal hernia repair and fold the stomach back onto the esophagus to recreate the valve at the end of the esophagus, and that would control both the regurgitation and the heartburn, as well as some of the other symptoms she was having.
He suggested that we do some preliminary tests, of course, but he thought that I was a good candidate to have a TIF procedure.
There are multiple procedures for reflux disease, and they're all called fundoplications, which is kind of a big term that means we're going to fold the stomach onto the esophagus.
Dr. Ihde is just such a caring physician and so involved in what is current and what is the latest information about GERD. I think Dr. Ihde is the #1 guy.